Well, I like to cheer and dance and draw. I like to sing with my dad and my family. I like to color and play with my brothers and my sisters. I was 7 years old when I got sick. I had a bruise on my side. We was in the emergency room, and the doctor came in and they said that I had cancer.
I remember 4 years ago seeing this young girl, and I had given the family about a 5% chance that she was going to survive the transplant.
I had a bone marrow transplant. They'll put me to sleep, give me some magic milk, and then they'll give me a shot in my back. That's all I know.
She survived. But not only did she survive, she came back to my clinic today, 11-year-old girl, bright, cheery, smile on her face. And so the reward that we get every day is knowing that, we're going to save somebody's life. Research is very, very critical for us to continue to make strides in bone marrow transplantation. 20 years ago, pediatric cancer patients had about a 50% chance of survival, and now we're up to 80 to 90% survival rates. And that's really all related to a lot of research that's been done in the area. Our pediatric blood and marrow transplant program is one of a kind. It's the only one in the state of Alabama. We have a wonderful partnership also with UAB in that it brings in some of the best researchers in the country right to our doorstep, and that's what helps our children.
When we first had Kyler, we were so excited. He was our firstborn. And then when he was 4 days old, he was bleeding. So we came to the emergency room and he had low platelets, and then when he was 2 months old, he was diagnosed with an immune deficiency. We were told he would need a bone marrow transplant.
My entire transplant team, the nurses, pharmacists, child life workers, everybody, probably 50 people are involved in just taking care of one patient. And it requires a huge amount of dedication, coordination, resources. And we're blessed here at Children's of Alabama because those resources are available to us.
It cured me because now I'm better. I just come and get checkups.
The care we got here was nothing short of amazing. Kyler is 5 years old today, and he is a perfectly healthy, tough, sweet, loving little boy. He does not remember anything he went through. He has no clue it even happened. He thinks he comes here just like he goes to the pediatrician once a year. He doesn't know it's any different. He is an inspiration to me, and he is actually the reason I went to nursing school and became a nurse. So I completely changed my career goal because of him.
What is it that families are wanting? What is it that the caregivers are wanting? Well, we all have hope, but we want new discoveries. What we hope to discover may not only help children with cancer, but we hope someday that it'll help everybody with every disease, because the things that we learn in the laboratory, for instance, or in some of our patients, they're applicable to everybody and to every disease.
The nurses were so wonderful, and Dr. Goldman was so wonderful, and I really just feel like Kyler got the best care he could have gotten.
I want to thank Teresa and Rachel and all my nurses for taking care of me, because I wouldn't be here without them.